Thank you, Madam President. Madam President, I come to the floor today, as I do each week, as a doctor who practiced medicine in Wyoming for 25 years, as someone who's taken care of families all around the state of Wyoming, as a doctor who has great concerns about what's happened to the American health care system and will continue to happen under the health care law that has been passed by this body and signed into law at the insistence of this president. And I come as a doctor giving a second opinion because I have great concerns about this health care law, because in talking with patients and talking with doctors and just from my own personal knowledge, I believe that this health care law is going to be bad for patients, bad for providers, the nurses and the doctors who take care of those patients, and bad for the payers, the taxpayers of this country who are going to be left to pay the bill. And Madam President, recently my friends on the other side of the aisle have been using what I believe to be significant scare tactics about my party and Medicare. Medicare is the program for our senior citizens. And I believe it's important the American people receive the truth. They deserve to hear the truth about the future of Medicare, not scare tactics. The fact is, unless Congress takes action, Medicare will go broke in 13 years. In 13 years, Medicare will go broke. Today, more money is going out than is coming in. A bankrupt Medicare equals no Medicare for our seniors. These are people who paid into Medicare, but a bankrupt Medicare means no Medicare. If Washington doesn't show leadership now, today, this year, this program is going to run out of money and Medicare patients will run out of care. Now, many of my friends on the other side of the aisle continue to ignore the ticking clock and ignore reality. Well, let's take a look at some of the reality that the other side is ignoring. They're ignoring the fact that the life expectancy of the United States has risen significantly since Medicare was signed into law. When Medicare became a law, the average at that time was 1965. Life expectancy in the United States was about 70. So on average, you're talking about people being on Medicare for a certain number of years. Well, now through the advances in modern medicine, the life expectancy of the United States is almost 80. High 70s for men, low 80s for women, but it's about 80. People are living about 10 years longer now on average than they were at the time Medicare was signed into law in 1965. It's an undeniable fact. Another fact is the fact that there are about 10,000 people, new Medicare recipients, added to the rolls every day as baby boomers turn 65. An entire generation of baby boomers is retiring. The other side seems to ignore the fact that there are far more retirees today than ever before, and they are getting more money paid out of the program than they ever put in. Now, I have town hall meetings, I travel around the state of Wyoming, and people say, you know, I paid into Medicare, and they are absolutely right. On average, a couple that will be retiring this week has paid into Medicare about $110,000. That's over a lifetime of working. That's a significant amount of money they paid in. So what kind of services will they receive over the remainder of their lifetime? Adjusted for today's dollars, $343,000. So you're talking about $109,000 they paid into the system, taking out $343,000. Well, American seniors know that Medicare is in trouble. They understand that the math doesn't add up, that this $3 coming out for every $1 paid in cannot work forever. My friends on the other side who attack Republicans for wanting to address this problem in a responsible way tend to want to ignore this reality. To make matters worse, members on the other side actually voted for a health care law that puts Medicare on an even faster track to bankruptcy. In fact, the president's health care law cuts $500 billion from Medicare. Not to save Medicare, not to strengthen Medicare, not to secure Medicare for the next generation. No. They took $500 billion from our seniors on Medicare to start a whole new government program for someone else. And so it was no surprise to me when I read recently that those folks who take a look at the numbers, work for the government, say Medicare is going to be broke 5 years sooner than even they had anticipated. It's odd how Democrats never even mention this when they attack Republican plans to save Medicare. Well, when they run advertisements and hold press conferences focused on scare tactics, why don't they ever explain their own $500 billion cut to Medicare? It's also odd to me that the Democrats never talk about the other very significant piece of the president's health care law that attacks our seniors on Medicare. Hidden away in the bill, it is called the President's Independent Payment Advisory Board, or IPAB. Now, as a doctor who's practiced medicine for 25 years in Casper, Wyoming, I can tell you what this board really is. It is a rationing board, a board to ration health care of our seniors in this country. Now, rationing, some may say, is a very strong word, but that is exactly what it is. The president's health care law puts Medicare on the road to rationing. This health care law creates an unelected, unaccountable board of Washington bureaucrats who will decide how much Medicare pays for certain Medicare services. Starting in 2014, after the next presidential election, starting in 2014, members of the board will decide how much they will reimburse hospitals, how much they will reimburse doctors for taking care of Medicare patients. Then, providers all across this country will have to decide whether or not they can continue to care for Americans' seniors. Let's face it, even today, doctors are running away from taking care of patients on Medicare. According to the American Medical Association, 1 in 3 primary care doctors already limits how many Medicare patients they are willing to see. According to the same survey from the American Medical Association, 60% of doctors say that they're looking for ways to get out of Medicare completely. So, even more providers are going to stop seeing Medicare patients. This situation will continue to get worse. If you don't believe me, ask the seniors in your own community. When a doctor retires, ask somebody on Medicare how easy it is for them to find a doctor to take care of them. If they happen to be with a doctor and they turn 65, ask if they're allowed to stay with that doctor. Or if they move to another community to be closer to their children or grandchildren, ask them how easy it is or how difficult it is for those on Medicare to find a doctor. The reason, of course, is because Medicare pays a lot less than the going rate, but yet the Democrats and the president's solution is to pay even a lower amount and continuing to ration and ratchet down that amount, resulting significantly in additional rationing of care as our seniors find it harder and harder to find physicians and nurses to take care of them. The other thing about this rationing board is it actually gets worse when you take a look at the details. It will be practically impossible for this Congress or any Congress to overturn the rationing board's recommendations. Again, to me, it seems very odd that my friends on the other side of the aisle don't talk about this rationing board when they hold their Medicare events. But as Nancy Pelosi said, first you have to pass it before you get to find out what's in it. The American people continue to find out what's in this health care law, and they continue to oppose it. I would say to my colleagues on the other side of the aisle, if you're so proud of the work you've done on Medicare, then you should stand up and defend this rationing board. My colleagues on the other side of the aisle should explain to American seniors how it will work and how it will impact their care. America deserves a thorough and honest debate about the future of Medicare and how we got to this point and how we can, in a responsible way, strengthen and secure Medicare for those on Medicare and for the next generation. Now, Madam President, I bring this all to you today because today a new study has come out in the New England Journal of Medicine, just came out today, and it has to do not with Medicare, a program for our seniors, but with Medicaid, a program for low income, and specifically, in many cases, for children. And the study from the New England Journal of Medicine today talks about how very difficult it is for people, specifically children on Medicaid, to even get an appointment to see a doctor. During the healthcare debate over the last year, I've come to the floor continuously, talked about the fact that many physicians refuse to take patients on Medicaid because the reimbursement from the government is lower than the cost of actually even treating the patient in terms of paying rent, office expenses, and other things. And this study out today in today's New England Journal of Medicine talks about researchers in Chicago who called a number of doctors' offices with identical voice, same person calling actually the same office a month apart with the same symptoms of the same child, whether it was asthma, different sorts of conditions, diabetes, a child for care. And the question came, have insurance? Are they on Medicaid? And what they found is that for 89% of those with insurance were able to get an appointment, regular insurance. Of those saying, no, we have Medicaid, and they called hundreds and hundreds of offices and clinics. For those on Medicaid, only 1 in 3 was able to get an appointment. I mean, think about that. And it's something for our seniors to think about as well, as the President's Rationing Board pays less and less for a visit to a doctor. And we've talked about the fact that Medicare rates, as a result of the $500 billion cut from Medicare, will be in many places similar to Medicaid rates. So I would assume that at some point very soon, seniors are going to have the exact same amount of trouble getting an appointment to see a physician as the New England Journal of Medicine found today for children on Medicaid. And with that, Madam President, I will say I will continue to come back to the Senate floor week after week with a doctor's second opinion about a health care law, because week after week we see new information, new relevant information about how the impact of this law, this broad, sweeping law, significant changes for the health care of all Americans, how it is, in my opinion, bad for patients, bad for providers, the nurses and doctors who take care of them, and bad for our taxpayers. With that, Madam President, I yield the floor and suggest the absence of a quorum.